requested equal time, but all three networks refused, saying that theirs was a partisan political message. The ingenious decision was made to rent out the Garden after all the people had left, to allow Dr. Edward Annis to deliver his rebuttal. The President of the United States, followed by your family doctor. Dr. Edward Annis stood before thousands of empty seats and delivered his address. It turned out that he had one of the largest television audiences on record up to that time, over 30 million viewers. Now let's see what Dr. Annis had to say.
Men and women of America, I appeal to your sense of fairness. Nobody, certainly not your doctors, nobody can compete in this unfamiliar art of public persuasion against such massive publicity, such enormous professional machinery, such unexplained money, and such skillful manipulation. Of course it's unfair when the proponents of King Anderson, by having the President address their rally, get their story and their show televised all over 3 networks, free of charge, as a news event. Of course it's unfair when your doctors, asking for equal time to make reply, got turned down and have to pay for a half hour on one network to tell you the other side of the story. Unfair, yes, not to us so much, but to you. We doctors fear that the American public is in danger of being blitzed, brainwashed, and bandwagoned into swallowing the idea that the King-Anderson bill is the only proposal, the only program that offers medical care for the aged, that there is nothing else. Well, let's put that outrageously false idea on the bandwagon and send it back where it came from. Just 2 years ago, your Congress in Washington enacted into law the Kerr-Mills Medical Aid to the Aged program. The Kerr-Mills law has already been accepted by 38 states and is being considered by others. It's on the books. It's a brand new national law. Why aren't you hearing more about it? It works. The American Medical Association and most doctors in this country supported and do support the Kerr-Mills law because we see it as a desirable supplement to one of the greatest social advances of our generation. I mean the spectacular growth of private voluntary health insurance systems to which millions of Americans already belong. Of our 17 million people past 65, over half, 53%, or 9 million, 3 times as many as 10 years ago, already are covered by some form of voluntary health insurance or a prepayment plan. This is a spectacular forward movement. Insurance actuaries estimate that by 1970, 80 to 90% of the aged will be covered by private programs. Of course, there will always be a number of people who are truly indigent or who just cannot pay for their medical needs. That is where the Kerr-Mills Medical Aid for the Aged law comes in. Please, do not be blinded by the scare words of propagandists. Now let us make an X-ray examination of what they are attempting to sell you. The King-Anderson bill. Let's find out what all the cheering was about. At the same time, you'll find out what this fight is about. Here it is, the King-Anderson bill, H.R. 4222. Yesterday, you heard the President say, well, no, let's listen to his own words.
Well, let's hear what some people say. First, we read that the AMA is against it, and they're entitled to be against it. Though I do question how many of those who speak so violently about it have read it.
Well, the President may question that we've read this bill, but I will gladly leave the answer up to you as to whether we've read it. Instead of singing along with Mitch, suppose you read along with me. First, I read the title, the Health Insurance Benefits Act. Is it genuine insurance? No, it is not. The Supreme Court has held more than once that the Social Security system is not an insurance system. It is the way we have chosen to cushion the general economic needs of old people in this country. The Social Security tax, collected from those under 65, pays benefits to those over 65. Why not be honest about it? I say any health program that calls itself insurance and isn't has to be bad to begin with. And what about those who would be covered? Meaning everyone over 65 eligible for Social Security. That means everyone, the rich, the well-to-do, and the comfortable, as well as those of low income, whether they need it or not, whether they want it or not, they'd be in. The American taxpayer, whose payroll tax would be hiked by as much as 17% to start with, in order to pay for this program, certainly has a right to question the free ride those who do not need these benefits would be taking at the expense of his children. This bill would put the government smack into your hospitals, defining services, setting standards, establishing committees, calling for reports, deciding who gets in and who gets out, what they get and what they don't get, even getting into the teaching of medicine, and all the time imposing a federally administered financial budget on our houses of mercy and healing. Ladies and gentlemen, this King Anderson bill is a cruel hoax and a delusion. It wastefully covers millions who do not need it. It heartlessly ignores millions who do need coverage. It is not true insurance. It will create an enormous and unpredictable burden on every working taxpayer. It offers sharply limited benefits. It will undercut and destroy the wholesome growth of private, voluntary insurance and prepayment health programs for the aged, which offer flexible benefits in the full range of an individual's needs. It will lower the quality and availability of hospital services throughout our country. It will stand between the patient and his doctor. And it will serve as a forerunner of a different system of medicine for all Americans. If our government wants to move toward welfare state medicine, let them tell us so honestly. Why sneak it in piece by piece on the backs of old people first? The King Anderson crowd intends to take us all the way down the road to a new system of medicine for everybody. And don't mistake it. England's nationalized medical program is the kind of thing they have in mind for us eventually. Today, after 14 years of national medicine, more and more people in England are buying private health insurance, on top of paying the heavy compulsory tax for government medicine which they don't use. These people want private medical care. That's what we have here. The people have a right to remind their first servant that his election, even his present popularity, does not authorize him to change fundamental institutions that have proved their lasting value through the generations. Nor should he tamper with fundamental human relationships which are sacred in that they involve the creation of human life or the preservation of human life. There are few such things which touch so close to God. And the relationship between a doctor and his patient is one of them. All of you who occupied these 18,000 seats yesterday, you are at home now. You have time to think. You have time to ask your doctor. To the millions of Americans who may have a doubt, who may want to take a moment to hear the views of one they know and trust, I implore you, ask your doctor. Ask your doctor. Thank you.
On July 17, 1962, the votes were cast. King Anderson lost with a vote of 52 to 48, largely because of the efforts of Dr. Edward Annis. Then came the assassination, and President Johnson was able to institute his Great Society in the name of our martyred president. King Anderson this time swept through Congress, and the program that is now called Medicare was born. Dr. Annis, now 83, remains an articulate spokesperson for freedom in medicine. We are privileged to have him with us here today. Please welcome Dr. Edward Annis.
Well, they said we were wrong. I had the opportunity to meet with President Kennedy in the Oval Office. And I